Aging in place is about being able to continue living in your own home or neighborhood and being able to adapt to your changing needs and conditions. There are steps you can take to lessen any potential dangers to allow you to remain in the comfort of your home for much longer than in generations past.
There definitely are so many ways that we can age healthy in our own homes and make some minor changes that can help us to be able to not have to leave our home environment, but be able to maintain our independence.
Do a look through of your own home. Make sure you have railings on both sides of the staircase. Is there a light that you can reach that your parent, if they're coming home late at night by themselves, can they turn on the light right in front of the doorway? A lot of older homes have laundry in the basement. See if there's a way you can put a small laundry room upstairs. And then just encouraging older adults to exercise. Not everyone can afford to join a gym and things like that, but going outside, even just sweeping your front walkway, small little things can make a big difference.
In the tri-state, we've seen a spike in fatal falls in the last 15 years. Emergency services in Colerain Township say they get hundreds of calls a year about people over the age of 65 who have fallen.
In 2016, so far we're on pace to reach 990, so just a little under 1,000 falls, which represents a 14% increase.
The partnership between the UC Medical Center, people working cooperatively, and the Colerain Township Fire Department resulted in the pilot program helping aging adults in assessing their needs and preventing falls.
The culture change needs to occur at the point to where we begin to understand and embrace the concept that we need to be a little bit more proactive in stopping the emergency from happening.
This means firefighters and emergency personnel will need to go beyond their basic duties.
Now all of a sudden we're starting to change the job description a little bit, and we're starting to say, well, not only do you need to respond to just their emergency when they're having chest pain and having a possible cardiac event, now we're starting to say you need to come out to their house and prevent the fall from happening in the first place.
Fire crews would go through seniors' homes and try to help them get rid of tripping hazards or movements that might make them more likely to fall. Assistant Chief Mueller says the goal of this pilot program is to unburden the healthcare system through prevention.
The outcome we're looking for is a reduction in the number of falls that we're presented with. That's the number one priority. We are looking for reduced injury, risk of injury. We're looking for reducing healthcare costs. We're looking at reducing run volume. We're looking at reducing the stress placed upon the healthcare system. Those things are the outcomes that we're specifically looking for.
I think when it comes to preventing falls, it's a combination of factors. It's a combination of, the programs that we have within Tri-Health for fall prevention, where people can actually attend classes, whether it's a short 2-hour class or a 7-week series, where they're just more in depth learning about what they need to do in their lives. Or sometimes it's just a matter of working with an agency like People Working Cooperatively, so that changes can be made within the home, not sweeping huge changes, but oftentimes just simple changes.
So the goal is to make sure that the homeowners can come into their bathroom and use it safely. And in this case, our homeowner had a bathtub which he could no longer step over. So we took that bathtub out and we installed a barrier-free shower pan, which includes the shower pan, new shower walls, and lots of accessories that really make it safer and easier for them to use. Also, we've installed a new toilet, and this one is called a comfort height, which is just a little bit taller, and to give him something to hold on to, we put in a flip down grab bar. Because there was no other place to mount a grab bar, this is perfect for this application. And that brings me to this flip down shower chair. There's a lot of options, a lot of different types of chairs. We like this one because you can flip it up out of the way when you're not using it, and when you are using it, it just flips down so that you can turn and sit and use it.
Well, they come in, put me a new bathroom door in, and a new walk-in shower and toilet, so I could get in with my wheelchair to take a shower and that was the biggest help I've had in a long time. Now I feel like I don't have to rely on someone to do something for me. I can do it myself. That helps a lot.
PWC keeps people active and able to remain, their life the way they want to because we allow them to stay in their home. All the research says that people want to remain in their homes as long as they possibly can. But several levels of the house and just different things about homes weren't designed for people to age in place. And PWC makes that all happen, and we provide critical repairs and services for people that are low income that just can't keep up with their home needs.
Maple Knoll Village and the University of Cincinnati have a formal affiliation to tackle ways to age in place by their innovative collaboratory smart house, which is working to bring telehealth to the forefront of healthcare technology. Let's take a look.
In 2012, the University of Cincinnati's College of Nursing and Dr. Debbie Samsel had the idea of forming a smart house to incubate new technology and form intergenerational relationships with older adults and students.
So the whole house is equipped with sensors such as microwave, fridge. The restroom is equipped with sensors. So we use the data from all these different sources to understand how the person is behaving. And we are able to find out if there is any deviation from the normal behavior to that can identify onset of certain health issues.
There's a lot of new technology coming out with wearing sensors to kind of see how a person's body is moving, so kind of buzz when they think that they're going to come to a fall. There's a lot of things coming out. It's a very hot topic.